Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's overall health, the Myohacker podcast is your guide. Hi, I'm Karindy, a speech-language pathologist, myofunctional therapist, and a mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this important information. Visit myohackerslp.com for free resources and guides. Quick disclaimer. The content shared in this podcast is for information and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult a professional regarding your circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. Now, let's dive into today's episode. Welcome, everyone, to the Myohacker podcast. With us today is our favorite, Danielle Mitchell. We are going to talk all about how do you support the body before a surgery and then during the surgery and after. Like, what are the best ways that we can support our bodies? So, Danielle, introduce yourself for those who are not familiar with you, and then let's dive right in.
Awesome. I'm Danielle Mitchell. I am a co-owner, co-founder of the Cognizant Group. I wear multiple hats in our practice. I've spent years of my career, actually almost 21 years of my career as a dietitian, now practicing in functional nutrition, functional dietetics. And then for 15 years, I've been a licensed professional counselor. Also kind of added in some functional med health coaching and do equine assisted psychotherapy, all sorts of fun things that I get to do in my job. But today, Karindy knows I have a passion for really helping people kind of before, during, and after treatment and surgery. So this conversation has come up between she and I as we share patients back and forth all the time. So we're excited to kind of share some high points of all the things today.
Yes. And it's going to be punchy, guys. We're going to go from point to point. So buckle up. Let's dive into recovery starting before incision. What does that mean?
Yeah. And part of the reason we're going punchy is, let's be honest, if you are preparing for a surgery or if you are a parent or a caretaker of someone who is preparing for a surgery, like, you just don't have time to be thinking about it all. You're doing pre-op appointments, you're taking medication, scripts to and from the pharmacy. And so we really want to be to the point. When we think about surgery, one of the biggest things that I think gets missed is recovery starts before an incision, right? So a lot of people are like, what am I going to do after the surgery? How am I going to heal? How am I going to recover after the surgery? But recovery starts before the incision. We have data, evidence-based research showing that surgery outcomes improve when we have treated weeks before surgery as the preparation, right? Not just waiting till the surgery and then focusing on recovery. So in the dietetics world, my years at MD Anderson were spent helping people gain lean body mass, really focusing on pre-op protein intake. Yeah. Because when we're thinking about both skin integrity and tissue repair internally, that's what the body is going to pull from. It's going to pull from amino acids. It's going to pull from muscle. And so we want to make sure that we have both enough to preserve, like those days after surgery where you're not going to be moving, you're not going to be lifting weights, you're not going to be eating as much. We want to have something to pull from, and then we want to have adequate stores to repair. So one of the biggest things that I ask people to focus on before surgery, one, make sure if it is a child or an adult, doesn't matter, that you are consuming adequate amounts of protein. Two, I hope this goes without saying, but honestly, it probably needs to be said. I think avoiding any sort of tobacco, avoiding alcohol, avoiding excess sugar, even saturated fats or excess caffeine, those are going to be very proactive and gentle ways to just ready your body to go into healing mode.
Talk about the caffeine real quick. I know that it does disrupt things like detox pathways, but for someone like me, I'm like, it calms me down.
Right.
Talk me off the ledge. Like, why should I not be doing that?
Biggest thing is I should probably define what I mean by excess caffeine, right? So I didn't say avoid caffeine, avoid excess caffeine. We would say that is upwards of 200 milligrams of caffeine per day. So think about an 8-ounce cup, not a big tumbler, not your 5, 6 cups of coffee, but an 8-ounce cup of coffee is about 100 milligrams of caffeine. So excess of 2 cups per day would be what I would have people watch out for. There's plenty of benefits with caffeine. I particularly love the caffeine via tea, like matcha, green tea, black tea, because there's so many healing properties to tea. So again, don't avoid caffeine, but we want to focus on hydration. So some of you know that hydration can suffer when we're consuming too much caffeine. And we want to make sure that what also is going into the caffeine, right? Like the sugars, the milks, the saturated fats, that we're not kind of creating a pro-inflammatory environment prior to surgery. We want to be focused on an anti-inflammatory, very nourishing and nutrient-dense environment.
Absolutely. Love it. Okay, sorry.
question.
So I interrupted there. I was just
that's
like, I
okay.
always want to clarify.
That's okay. Then the question that I get asked is like, okay, beyond the things to avoid and the protein to take care of and kind of an anti-inflammatory way of eating, are there any nutrients that I should be taking or focusing on in a food form? And man, people are so literate in nutrition these days that what I'm about to say is probably like, duh. But I think focusing in on vitamin C, obviously this is a global statement. There are some people that won't or can't, but vitamin C, even just starting for an adult at 1,000 milligrams once or twice a day, zinc, if that is appropriate for that person. So vitamin C and zinc and a high quality multivitamin. Now, that is, again, a global statement. You are going to need to make sure that you have clearance depending on a type of surgery and your doctor. You're going to need to make sure that you have clearance on when you would need to stop those things. So personally, I've been through a massive surgery. I've had 2 sons who have been through a surgery. I would do all of my supplement regimen with the exception of fish oils. We'll talk about that in a minute. Any sort of omega-3 or fish oil, we would definitely want to start and then stop. So start months ahead of time, but I would say stop. Some people would say up to 2 weeks before the surgery.
Oh,
I
wow.
definitely say a week before the surgery, just to avoid any sort of excess risk of bleeding. And so, but vitamin C, zinc, a high quality multivitamin that contains methylated B vitamins, we'll talk about that more with the genetics. Those things you could, for most cases, take up until 1 to 2 days before the surgery. So again, always check with your doctor when you have that pre-op phone call. Say, hey, these are the things I'm on. Anything that I need to stop? And a specific question would be to ask, when do you want me to stop any sort of omega-3 fish oils before my surgery? So day of surgery or days before, you want to make sure you check with your doctor. But then you also want to have these things on hand after the surgery, right? This is not the time where we just say, well, the medications do their job. The second biggest point that Karindy and I talk about with our shared patients is healing is not passive, you guys. It requires resources. I am a proponent of saying that the body is incredible and it can heal itself. So I'm not saying you cannot heal without these supports, but again, healing isn't passive. So if you're really focused on wanting to get back to, quote, normal life or wanting to gain strength, we can't be passive about our healing. So our tissues, they need repair, they need nutrients, our immune system needs support, and we really need to balance out inflammation. Again, I've been through this with clients. I've been through this 3 times over in our own family. How tempting is it after you have a surgery to be like, I just want some comfort foods? Sadly, notoriously, hospitals are not always the greatest. Provided some healing
Please
food.
don't eat the hospital food, guys. That's the takeaway. Please don't eat it.
I'm trying to say that as respectfully as I can.
I'm just going to say it. Don't eat it.
No, I mean, those dietitians and the hospital staff, they work really hard to get that food there, but they're limited. Let's be honest. They're limited from a budget and how high of quality that food can be. And so I'm a big fan of saying, hey, when everybody's asking, what do you need? What do you need? Like, send them some names of some restaurants or some places around the area that they could get to the hospital, right? Leave it at the front desk and you could have some really nutrient dense food. So what should you be thinking about, right? it depends on the surgery you've had. I mean, obviously, if your
Mhm.
son or daughter or you have had a tonsillectomy, you're going to be limited in the texture of things you
Yeah.
could eat. But and I talk about this all the time in the surgery reels on our Instagram account. You can still get adequate amounts of protein and anti-inflammatory foods in even after some sort of surgery that limits swallowing or some sort of
Mhm.
surgery that impairs your digestion. So get creative, reach out to a dietitian, reach out to some of the resources that we provide or that you can find from other quality providers online. But make sure that you are focusing, number one, on adequate sources of protein in those days of recovery. And number two, that you are thinking about being proactive about anti-inflammatory foods. So this is not the time for the sugary beverages. It's not the time for all of the sugar-laden ice creams. Those are okay in
Mhm.
moderation, but we really want to be thinking, how do I get the protein, the anti-inflammatory fats, so things like avocado, nuts, seeds, nut butters, olives, right? How do I get some of those
Mhm.
polyunsaturated fats in to really start quieting down the inflammation that happens as a natural response to surgery? So, and tell me if I'm talking too fast here.
Nope.
I
Go.
really think like I needed in my mind, even as a professional, I needed in my mind a plan going into surgery and then thinking about what to do after. So
Mhm.
in my mind, I think like days 1 through 14 after a surgery, and we can talk more specifics if you want to about different types of recovery. But in general, days 1 through 14 are when swelling and inflammation and rebuilding demands are the highest.
Mhm.
Depending on the surgery, and your doctors will generally mention this, they'll say, hey, these are going to be the hardest days of recovery, right? But what I see happen is patients are 2 to 3 days out from surgery. For the most part, they're kind of feeling back to normal. And so they just let go of all of their
Mhm.
efforts of what they can do. And they're about a week in, and that's when all of the tissue starts to really increase its demand for healing. So
Mhm.
that's our peak healing window is about 7 to 14 days. We want to focus on nutrient density. I think I've already mentioned that. There are some things, again, if you can confirm with your surgeon, things like bromelain
Mhm.
and things like fish oil that can be really helpful. Bromelain for swelling and bruising support, fish oil to think about an anti-inflammatory. And then, oh gosh, I'm going to say this and it's going to raise a lot of questions, but do not be afraid of following the pain management protocol from your medical team.
I
Why do
absolutely am gonna encourage this because I see so many people that they will do, let's say, tonsillectomy, and
bingo?
then they're like, no, I don't. We're gonna do natural things, and we're not going to. And then this kiddo doesn't drink enough liquids. They end up going back in. They need IV fluids. It's a mess once we get there. It's a lot more of a strain on the body.
Right.
So I'm in that camp.
And I mean, you and I have both worked in hospitals, and I
Hmm.
think we would both classify ourselves as kind of crunchy granola mamas. And so I really want to build some comfort for both sides of, that conversation that on one hand, I'm a big fan of food as medicine, of supplemental support. We'll kind of talk about that here in a second.
Hmm.
But what I have seen in years of working with post-op individuals is that if you do not follow pain management as prescribed by your medical team post-op, you will be chasing the pain for weeks.
Hmm.
And as Karindy just mentioned, you could end up, not to scare anybody, but you could end up rehospitalized or your child could be rehospitalized because if we can't manage pain and inflammation, we can't provide the adequacy of that nutrition if we can't swallow or we can't tolerate foods. So, what I tell my patients is don't be afraid of the medications as prescribed, but also lean into the reason why you might have a hesitation. So, let's talk about one thing. A lot of people hesitate, Tylenol, acetaminophen. They'll hesitate because they know, again, very literate listeners that you've got on this podcast, they know like, hey, I've heard, I've read, I've experienced that those can decrease glutathione stores in the body, to which I
Yeah.
would say, you're exactly right. That is true. We know that. So maybe don't throw the baby out with the bathwater. Instead of saying, I can't use those things as prescribed for that period of time, how could we then work some glutathione back into the body? So cruciferous veggies, for those who can tolerate them, things like broccoli, Brussels sprouts, kale, cabbage, right? But for those who can't, using topical IV or even liposomal transdermal glutathione would be a way that we could kind of do one thing and also quiet that fear or meet that body's needs at that time. So we have lots of, different companies that we support as far as like recommendations for high quality glutathione. I know there's local IV drip spas that can do a glutathione drip. But one of the things I did with my kids and from my own surgical recovery is I had a bottle of Glutaril, which is a topical liposomal glutathione by RO Wellness. And I would use that over the right side of the abdomen. So in my mind, I could dose out what the doctor has told me to take or to give to my children. And then I could use that glutathione to help as an antioxidant and to also help with repairing or restoring glutathione stores. Any questions there, Karindy? I feel like I'm just...
I think it's really important too to note, like, in a way, when you have it, like, okay, we're going to follow these prescribed, how do we manage the pain? But then I think of, like, my oldest son, he recently broke his leg and he had an emergency surgery. And so we did give him pain medication really for that, the day following surgery and then the next day. But it was also, we didn't just go, well, they said to give meds for this many days. We were going, hey, buddy, are you in pain? What are you feeling? Sometimes I think it can be a way to like check out of being in touch with what is happening in the body. And we're not proponents of that. Like, we were absolutely checking in. What did he need? Maybe was he needing, magnesium? Was he what was going on in his body that he needed? And then if he was in pain, absolutely, he needed that medication. But really, it was only about 3 days that he needed a little bit of support for that. It was a pretty major surgery.
Yeah. And I mean, you spoke it so beautifully, thinking about like that checking in with the body. When we think about that checking in with the body, I mean, sometimes depending on the age of the child, how do you know your child's in pain, right? So there's the obvious like, oh, I am hurting, I am in pain. But what do you notice about your kid if they are maybe nonverbal? What are you going to notice when they're in pain? Has their appetite decreased? Are they feeling more lethargic? Do they get moody? We're going to talk here in a second about genetics. And a lot of kids post anesthesia, a lot of people, let's be honest, post anesthesia, they are not like calm, cool, and collected. They may feel really agitated or annoyed or easily irritable. And so again, checking in with yourself or kind of looking for those signs or symptoms of pain. So it's not just a dosing schedule for the next 16, days, but it really is like, what do we need now? What do we need now?
Yeah.
And you and I talk a lot about the nervous system. And I think that's a big point that maybe I should have hit on at the beginning, that we also have to prepare our bodies to rest after surgery, y'all.
Yes.
We just live in a culture where the goal is to get back to normal. And honestly, you heard me say those days 1 through 14 post-op are so critical for tissue repair and healing. So depending on what you're released to do, you may not want to go back to normal, right? You may have to go back to work or you may get to go back to school. But I think there should be a new version of normal for at least 2 to 3 weeks after most surgeries, where we are really quiet in our response to the nervous system as we allow it to get back to a place of safety and connection. And also why we honor what the immune system needs to do with its deepest repair to feel like we're supporting it. So
Absolutely.
I think, people talk all the time about fight, flight. And I'm like, okay, what about safety and connection? What about rest for our nervous system? And so maybe having a plan in place for that as well, right? Not saying when can I go back to driving or when can I go back to my activities, but maybe when should I is a better question.
Yes.
When should I demand that of my body? Or should I take it a little longer? I may have to go back to work, but what could I do differently? Or my child may go back to school, but maybe we don't go back to activities. Really saying this is not just a, hey, we had our surgery and we're done with it, but giving the body plenty of time to repair.
And even back to the nervous system, it impacts the whole family when someone goes into surgery. And so often we have to kind of go full throttle as parents on if it's the child that's getting the surgery or even ourselves. And you might find there's a sibling that's been kind of put on the back burner, or, other things that can happen where it's like we need to give some space as a family unit to get back into a new rhythm because it has changed.
Yep.
What is our new rhythm for everyone in the family? And giving, not rushing through that process, because it does take honoring of everyone's needs and everyone's situation in that case. I do want to jump to, you said like pain management in regards to it not being one size fits all. What are some of the supplements that you would recommend that are going to be outside of this? Like, what are some other ways we can support pain?
Yep.
Because we do want to try and do the supplements as much as we can. And I just even remember messaging you and be like, oh, that sounds amazing. What are some options that people can consider?
Right. Okay. So I'm going to make some generalized statements, and then we're going to talk about genetics, and I can make some very specific or individual statements there too. Obviously, there's a disclaimer. You do need to check with your medical provider to make sure any or all of these things are okay for your specific medical need or condition. Palmitoethylenolamide, better known as PEA. PEA comes in different brands. You can find it from different brands. Often it will come alongside with resveratrol. Both of those, but specifically the PEA, is known as both an anti-inflammatory and an immune modulator. It has medical studies backing up its ability to help the system with both. So when we talk about genes, I'll mention that I have a lot of clients that I have their nutrigenomics panel on file. And we know before their surgery that they have a higher propensity towards inflammation after their surgery. So we may do that PEA all the way up until, that sweet spot of the timing to discontinue before the surgery. And then we'll do as soon as the doctor allows after surgery. That PEA is one of them. Resveratrol I mentioned. Of course, vitamin C and zinc for tissue repair and recovery. Glutaril, as I already mentioned, for anesthesia detox and to focus on or serve as an antioxidant.
I do have a question about that. Sometimes people will want to know, like, can you support your glutathione too much so that the anesthesia is like burning through kind of fast? Is that
right?
possible?
Like we don't want to burn. Good question. So when we talk about pre-anesthesia glutathione, I would never have someone do this like the day of or the day before. We're really wanting to build those antioxidant stores and help detox. Again, a month or 2 months prior to surgery, but generally that week before is a time where I kind of say, hey, we don't need to be going full force on the glutathione because for obvious reasons, we want the anesthesia to do its job, right?
Mm-hmm.
What we don't want to happen is to avoid the anesthesia in general, and then people have a pretty nasty effect from anesthesia when they're coming out of it.
Yeah.
I always tell this story, and I'll tell it short here, that my oldest son had his surgery long before I knew anything about nutrigenomics. And it was the first surgery in our family. So I was imagining post-op recovery. I was imagining going to the PACU, that I was going to be holding my little 14-month-old, and he was just going to want to cuddle me like all the other babies around. What I experienced as a mom was wildly different. He was pulling out his cords. He was raging. He was angry, and that is not my kid.
Mm-hmm.
I realized years later, once I got his genetics in place, that he has a poor time detoxifying from the anesthesia. And so what I was experiencing was his confusion, right? He was confused about what was happening in the world around him. Fast forward years later, a second surgery that he needed to have. We had all of his genetics in place. I'll come back and talk about methylation, but he had been appropriately methylated and had been on this glutaril or glutathione for months before. We discontinued when it was time. And that experience in the PACU afterwards really proved to me that what we know or what we say to people works. Really does work. He was a wildly different kid. Same time under anesthesia, same anesthetics, right?
Mm.
Almost the same surgery. And so for me, it was like, wow, this makes a difference. So let me go back and mention something supplement wise that I had not before. And again, depending on the person, if you are a poor methylator, and that's going to be something that we know from doing nutrigenomics testing or genetic testing, having a methylation support for the months going into surgery is really valuable. So, what do I mean by methylation support? I mean methylfolate as tolerated. We'll talk about that. I mean B12 or B vitamins, and I really mean a high quality B complex.
Mhm.
When someone has those things in place, we really see that they do better on the back end, both with surgical recovery and in detoxing from their anesthesia.
I was just thinking real quick about the methyl B. Something I would love if you could touch on it is, okay, when people are taking either metformin
Uh-huh.
or a GLP-1 inhibitor
Great question.
prior to
Uh-huh.
surgery and the place of methyl B support in that context.
Man, it is.
Sorry.
No. I'm like, I tell all my patients, I'm like, I'm never going to be a know-it-all. And so if there are times where I'm like, it is a question I have heard come up, it is not one that I probably share the expertise. Um, what we know as far as like the deficiencies, maybe I'll speak to it from that
Yeah.
angle because I do see that clinically with not just metformin or
Mhm.
GLP-1s, but from a host of different medications that we know have a certain pattern of nutrients being deficient and B vitamins being a big host of them. It may be a little overkill to some people, but let's say you're on a prescription medication or have been on for some time and you are really wanting to heal and recover as fast as you can from a planned surgery. It's not a bad idea to partner with someone, a functional dietitian, a functional medicine provider, to maybe run a micronutrient test
Mm.
before the surgery so that you're not just haphazardly throwing methylation support at it if you don't need it,
Yeah.
but maybe saying, hey, I'm aware that I might be on a medication that could be uh, leaving me in a place of feeling deficient or being deficient in certain micronutrients or microminerals. When we think about it that way, then you could target those minerals or micronutrients very specifically. But I think a way to maybe kind of cover your bases, especially with methylated B vitamins, is go low and slow. If you don't know if
Mhm.
you have a genetic polymorphism, if you're not on any of those medications, and if there's any underlying inflammation, I would say go really low and slow on methylation support. I have said this over and over again. When people say, I think I was over methylating, like it made me agitated, it made me irritable, my take on that, y'all, is that I think you actually were probably fueling the fire with methylation. So
Mm.
that may be a physical reason why we would want to say, hey, let's really focus on the anti-inflammatory part of things and then slowly titrate up on methylation support because
Mhm.
generally those feelings of what people call overmethylation is really just appropriate methylation fueling a fire we didn't take care of first. So
Absolutely.
again, going back
Okay.
to your question, to go back to that, like I think micronutrient testing could be a wise
Yeah.
idea for someone who's been on a GLP-1 or metformin for some period of time.
So let's talk now about the genetics,
Genetic.
genomics, all of that, and how this plays. A question that did come in from a listener was, do we need to get genetic testing before being under anesthesia? And how does the genetic testing, specifically, we'll talk about the NeuroWell plus nutrigenomics panel, like how does that inform the planning and treatment?
Great question. If you can, yes. Now, I want to say that emphatically, like if the investment from a financial standpoint is there where you can get genetic testing or nutrigenomic testing before a surgery. And let's be honest, if you have the luxury of knowing before a surgery, we're kind of talking here about planned surgeries, but a lot of people don't plan a surgery, right? It
Yeah.
happens in an acute situation.
Yep.
So if you have the luxury of time and the financial investment, I think it is very helpful. I'll explain why, but I also just want to speak to the people out there that don't have that luxury, that don't have the ability to run the test or maybe don't have the time to prepare for that, please don't be fearful, right?
Mhm.
Again, the body's incredible. We can do so much to recover on the back end. And so don't hear us talking about genetics as if you are somehow going to be deprived of wellness if
Yeah.
you do that. But the big reasons why we run genetics to understand what someone may benefit from both pre-op and post-op would be looking at anesthesia detoxification.
Mhm.
So in our practice, and a lot of the providers that we refer to or share patients with, they will run one of two panels. There's a company that I love and respect so much called Fagron Genomics. We developed our NeuroWell Plus nutrigenomics test with them, and they also have a separate pre-surgical report. So the NeuroWell Plus nutrigenomics test does contain these pre-surgical genetic polymorphism SNPs or panel. But for someone who says, hey, I don't really care about all the other stuff, I'm really just wanting to think about this, there is just a separate pre-surgical panel. So there are sections on the panels that we look at anesthesia detoxification. So if, for example, someone does this little cheek swab, it is not a blood test, it's a cheek swab. They do this cheek swab and they say, hey, I'll throw out some jargon here. We say, okay, a CBS mutation. That may indicate that someone could benefit more so from trimethylglycine or from methyl tetrahydrofolate or 5-MTHF. And again, the reason for that is not just allowing our body to clear anesthesia, but it's also helping our body to come down from the inflammation or cysteine that could flare after the fact. And then we say, okay, someone has that mutation, maybe weeks or months after the surgery, we may want to run a plasma homocysteine. We may want to get some blood work done and just make sure that we're kind of quieting down the system afterwards.
Mm.
The other section that we run on those reports would be looking at, again, if someone could benefit from things like sulforaphane or turmeric. Sulforaphane is commonly talked about with like broccoli sprouts, but we think about sulforaphane or turmeric or green tea having a specific benefit for the NFE2L2 polymorphism or single nucleotide polymorphism. So it kind of helps us get really into the weeds, but personal, and what someone may benefit from most in helping with that detoxification from anesthesia. The third thing that I think about, and this is where I love partnering with medical providers who are looking at pain control, is there's a lot of pain management prescriptions that will be given. Sometimes these doctors will look at this genetic report and will say, hey, thank you for running that because this will help me define if my patient is going to be sensitive to opioids, right? So
Mhm.
what they're going to prescribe will then change based on this genetics. I don't do that, right? But patients may need lower doses of morphine. They may need higher doses of morphine for their pain control, just depending on those genetics. And so that's where we can partner with medical providers who are providing prescriptions. And then finally, we kind of touched on this earlier, but I'll say it real specifically. When people say, okay, I think I'm past the period of time where I'm going to take the pain medicines that my doctor has prescribed, but I would still like to be doing something to kind of manage the intermittent pain or maybe the things that may pop up when I overdo it. And so this part of the genetic report can help us look at neurotransmitters, like where may someone be more predisposed to anxiety or depression following a surgery, and what can we do with good nutrients like inositol or methionine or all those B vitamins we talked about or SAMe. Where can we really personalize that for the person so that we're not just treating the tissue and the organ that's
Yeah.
repairing, but we're really treating the whole person and saying, hey, you've also suffered a trauma, right? Like surgery is a trauma. It's a different sort of trauma, but it is a trauma. Your life has been put on hold for a time. And so how do we make sure that we get all parts of you back to a place where you're feeling like you're getting the healing that you need? So those are some high points, that we can focus on. And then all the time, I get asked the question, well, what if I can't do that? Well, hopefully you heard me mention some things that you can do from a diet standpoint, right? Anti-inflammatory, eating those cruciferous vegetables, focusing on healthy fats, so that if you don't have genetics on file, you also don't feel like you are without an answer or a solution.
Even being hydrated, make sure you're actually drinking adequate amounts of water, some electrolytes, that can be so
Minerals.
supportive. Yeah.
Yeah, I think beam minerals or
Yep.
Quinton on the back end.
Yep.
I just thought of this when you were saying hydration. We don't have to give our kids all of the artificial food dyes in the popsicles. Like, focus on good, high quality stuff. I
Yeah.
think on the Cognizant group stories, we have a surgery story, and I made some very simple reels about things that we gave to my son, including Manuka honey, right? That was one thing I didn't mention, but not a pill, not a medication. Manuka honey can have some anti-inflammatory benefits. And so when my son, after his TNA, was in the hardest stage of recovery for him, I would make a little paste of Manuka honey and get him to just eat off of that same spoon. Or we would focus in on making homemade popsicles, right? So things that you don't have to do this, mom, dad. Like, think about the people in your world who are saying, what can we do for you? What do y'all need? Please don't be afraid to say, hey, this is what we need. We need some of these things from the grocery store. We would love for someone to make these popsicles. We really would love for someone to take our kids away, the other kids or siblings away for a play date so that we can just be lazy on the couch. Not really lazy. Rest is the word I use. Rest is not laziness. It's biology. Our body.
It's so funny. I had a sweet, sweet patient. She was like, what can I do when, my son was in surgery? And I was like, nothing, I'm good. And then I was like, no, hang on. I was like, actually, can you make some protein balls? I just need some quick pops of protein to make sure he's getting all that protein. So when people reach out, I think so often we're told to just be like, no, you're fine. You're fine. I was like, no, I'm not. I need the help. Can you do this? And be specific, because people, they want to help, and it's wonderful.
And y'all, I'm going to be a counselor for a second. I am a counselor, so my counseling hat is coming on here. I had a friend whose son with a disability was in the hospital for 2 weeks, right? And I had to practice what I'm about to say. Don't say, hey, what do you need? As the friend or as the provider, don't say, what do you need? People who are post-op can't think about what they need. They are thinking about how they feel. So one of the best strategies I encourage people to use is come up with 3 things that you truly could offer. Hey, I could come by and do a load of laundry. I could bring some groceries. I could deliver a meal to the hospital. Right, whatever is within the realm of what you are capable of, and send that message over, right? Send those specific things over so that you can say, okay, let me think about what I'm capable of providing, and then how can I meet those needs?
Absolutely. So I wanted to give a moment to talk about an exciting event that is coming up. So everyone, if you're listening to this podcast episode when it comes out live, you have the opportunity to participate in an event that both Danielle and I will be at coming at the end of March 2026. Share about that briefly before we sign out.
And some of you may be like, how in the world does this connect to what we're talking about? I mean, if you are a mama or a woman who has been through surgery, this would be a perfect opportunity for you to come and get some rest and relaxation. But if you're not, come and hang out with us. This is a retreat at Iron Horse Ranch, Friday evening, March 27th through Sunday morning, March 29th. The Embrace Wellness. It is a women's midlife functional health retreat. We're not defining what midlife is. If you feel like you're in midlife, come join us. We will be having plenty of time to rest, to relax, but lots of education to be provided. So Karindy is speaking, I'm speaking, Dina Norton with Back to the Book Nutrition, and Tony Boyahan with Kale Functional Medicine are all going to be there for the weekend. We got lots of add-on services, and it is a lovely place, you guys. It is refined meets rustic, I think is what Iron Horse website says. Refined meets rustic. So come hang out with us.
So guys, if you're wanting to talk to other moms, other individuals that are in this space and really trying to support their families, support their kids and themselves from a holistic perspective. And, like Danielle and I were saying, maybe you need the pain medicine for this. Maybe there are other ways that you can support the body and its healing process. This is going to be the room to be in. These are the people you want to talk to. I'm going to be bringing a bunch of biohacking gear and gadgets because I'm like, these are the people that we want to hang out and biohack together. So it's going to be fun. Lots of laughter, lots of time outside, rejuvenation. We just hope you guys can be there. I know Danielle and I are planning it and we're like, yes, this is going to be amazing.
Some people are like, I just want some time alone. I'm like, awesome. We will also provide you plenty of space to just get your time alone if you need to rest.
For sure. For sure. Well, thank you so much for your amazing time and your expertise. I always love just hearing from you, learning from you for myself. It's so beneficial to my family. You guys, you can find Danielle at The Cognizant Group. She's on Instagram. The website is thecognizantgroup.com and wonderful resources there. So you know the drill. Please like, share, and just follow this podcast. Get this information out to people. It helps for, let's say there's a family that you know that just went through a surgery. They need some information. Here you go. We got some great details that you can share with people who need it. All right, everyone, have an amazing day, and thank you for your interest. I hope you have enjoyed this episode of the Myohacker podcast. Remember, small changes can make big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review wherever you get your podcasts. This way, more families will learn about this important information and we can make a bigger impact. Head on over to myohackerslp.com for in-depth resources and guides. You can also join me on Instagram at myohackerslp for bonus content and demos. And if you have questions or topic suggestions for future episodes, send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection and breathing. Quick disclaimer reminder, the content shared in this podcast is for informational and entertainment purposes only.